Welcome back friends, Dr. Rajamahendran here. Today we are going to talk one of the important specialty most students are waiting for, that is anesthesia. So anesthesiologist. So why I am not talking more about them in various of my previous videos like career counselling guidelines and many other videos I have done. I am not speaking about them, but I have written a lot of things about the anesthesiology course. And let me tell you, the reason why I am not speaking about the specialty is very simple. All of us, when we do something, we like to be credited by the community. So when we do something, like for example, when we do a surgery, when we treat a patient, we expect the patient and the community to praise us, to speak about us to other people. So these anesthesiologists are marvelous people. They do excellent job, extraordinary work. They make the patient go into anesthesia and bring them back to life. In spite of such an extraordinary job done by them, they are the unsung heroes. Okay, they are the unsung heroes. Next to radiologist, anesthesiologist is another unsung hero. Most of them are not known in the community. Even when you go and ask anybody in the practice, nobody will be knowing any name of the specific anesthetist. Only the surgeons even will be knowing, even the physicians and other specialty people will not be knowing them. Only gynecologists and the surgeons might be knowing who are the best anesthesiologists in the practice. So therefore, it's one of the reason I am not speaking more about anesthesiologists. But it doesn't mean anesthesiologists and surgeons are like a Tom and Jerry. We are always close friends and we all have a common thing of getting a stress in any surgery. Therefore, it doesn't mean so. Just I wanted to tell for the young juniors who are going to take anesthesiology, if you are interested in taking anesthesiology, you should be ready to compromise your life as an unsung hero. You will never be known to the community and the people, number one. So second question, how is the vacancy? After finishing anesthesia, do I have a vacancy? Yes. Among the various clinical subjects, anesthesia has extraordinary vacancy in both government job as well as private job. Both in government job and private job, you have enormous vacancies and you can get good salary as a fixed salary in many setups, in many medical colleges. If you want, third question, if you want a private freelance practice, which is better, to have a private freelance practice, is it good or not? If you want to see loads of money in practice, it is only by doing a freelance practice, which is very important. So anesthesiologists are available 24 hours across 7 days, are most demanded than the talent. So those guys who are available at emergency will be given more and more importance and will be called upon for many of the cases. That is the first important thing, because as surgeons, what we want, we get a surgical patient, we want to operate immediately. We don't want to delay the case. Either it is even if it is an elective case, we don't want to postpone because the patients are have flattering mind and they go somewhere to another surgeon. So we don't want to miss the patient and we mobilize the patient for surgery at the earliest possible. So if the anesthetist is not available at that time, we may call another anesthetist who is available on call 24 hours, 7 days. So if you are going to show availability, you are going to earn in lakhs. I'm telling you, earn in lakhs. If you are going to show non-availability, you are going to earn in thousands. That's simple. So availability is inversely proportional to the earning. So another important thing, there's a surgeon call because of a special talent in anesthesiologist means it is very less. Very few super specialty surgeons will call the anesthesiologist for the special talent and for a serious case or for a sick case. But most of the surgeons, they will call an anesthesiologist for the availability and the friendship they have. That is a major reason that anesthesiologists will have a good relationship with the surgeons, and always that is very important in a freelance practice. So 4, what is the basic nature you should see in an anesthesiologist? Very important question. If you are a person who is a little arrogant, who never wants to bend to anybody, you should never take anesthesiology. So anesthesiologist you can see in government hospital looking like majestically, and they will be behaving and all the surgeons will be coming and requesting them for surgery. So don't think that sort of nature happens in the private practice. It is totally opposite. You will never see such type of anesthetists who have so much of attitude in government hospital shining outside in a good way. So those anesthetists who have a good relation and friendship with the surgeons and who are always available and humble will always get an extraordinary income because of the surgeon. Because for anesthesiologist, the customer is the surgeon. For anesthesiologist, the customer is a surgeon. For surgeon, the customer is a patient. For anesthesiologists, there is no direct customer like a patient. So he has to depend on surgeons, physicians, orthopedicians, ENT, ophthal surgeons, etc. So therefore, the more and more the humble nature and the character determines the income of this anesthesiologist. So that is very important. You should have if you are interested in taking anesthesiology. So number 5 is a medico-legal issue. So why? So both radiology is an unsung hero course as well as anesthesiology is an unsung hero course. Why people prefer for radiology is very simple. The income is also not so bigger like an anesthesiologist in radiology, but still people prefer radiology because of the medico-legal issues are zero among the radiologists unless you become an intervention radiologist. Whereas for anesthesiologist, each and every case he is responsible. Even if the patient dies in the immediate post-operative period, many times it is because of anesthetist complication. So therefore anesthesiologists are always having the stress higher than anybody else. Even than the surgeons, the anesthesiologists have the biggest stress, especially that one day the patient is being taken for anesthesia, surgery completed, shifted to the post-operative and patient recovers fully. That day the anesthesiologists are in full stress. So therefore medico-legal issues are also very high, equal to surgeons for anesthesiology. That is the reason people prefer less anesthesia course. Stress and sleeplessness. This is the sixth important thing you should be ready. When you take anesthesia, you should be ready to compromise your sleep. You have no fixed time job. You don't have a fixed time protocol. No sir, I like anesthesia, but I want to have my restricted life. Yes, you can always. If you want to have a restricted time job, yes, you can tell your friends, everyone, I can only come between these cases, between this, up to 10 o'clock only I can come. After 10 o'clock to morning is 6 a.m., please don't call me, I will not be available. Like that you can restrict the more you restrict yourself, the more the caseload and income goes down. But it is up to you. You can, if you want to earn more, you can earn the biggest amount by becoming an anesthesiologist. Like equal to a surgeon, if you want to earn, you can become an anesthesiologist because the highest income of crossing 10 lakhs you can see only in a surgical course and in anesthesiology course. I have seen friends who practice around 7 to 8 cases per day, and at the same time I have seen anesthetists practicing 7 to 8 cases per month also. It all depends upon the way which I told you so far. Recognition in the doctor community. So the 7th question, so will I get a recognition at least in the doctor community? I'm telling you, even in the Indian Medical Association, most of the anesthesiologists will not be there in the group because they don't get a recognition apart from the surgeons. So non-surgical people will not be knowing most of the anesthetists. So even in the doctor community, you have a very less recognition. Only a surgeon knows who is a good anesthetist or who is a bad anesthetist. Otherwise, you will have very poor recognition among the doctors as well as among the patients, and you should be prepared for that. And if you are going to become an anesthetist, okay. So dependency, the number 8 question is very important thing I want to tell you. I had a friend some years back was a leading anesthetist. He used to operate 10 cases per day, and he used to go for one one gynecologist who used to take 6 to 7 cases. That gynecologist will call only this surgeon, only this anesthetist. So what happened? Days went on. So one day the gynecologist called this anesthetist. He was not available and he could not come for a case which was complicated by the gynecologist, and the gynecologist stopped calling this anesthetist because he was not available for call on that day. And from then onwards, that anesthetist was earning around 5 to 7 lakhs per month. His income dropped to 1 to 2 lakhs, and he started that because that gynecologist is not calling him anymore. That is a major problem because if you are going to depend on 1 or 2 consultants for practice, and if those 2 consultants are going to cut yourself, you are going to become totally deserted and you have to start your practice right from starting again. So that is a major drawback among the anesthetists. You have to be independent. So dependency is a curse among radiologists and anesthesiologists. Income is fine, but dependency, you can depend on patients. Patients are much better than our own colleagues. Our own colleagues are the most worst people. They will never be happy for your own growth. So radiologists and anesthesiologists have to depend on the surgeons and the other practitioners. And radiologists, you know very well, most of the centers, radiology scan centers, they give referral fees and they cover most of the practitioners. But anesthesiologists, they cannot even give a referral fees. They have to be more dependent than a radiologist in practice. That is a major issue. And number 9, so to prevent this dependency, I have seen many anesthesiologists, they have started their own courses, like their own practice, like general practice. Some people join ICU setup. Some people start their own ICU. I have seen one of my friend who has started his own ICU setup with a full setup. He's earning lakhs and lakhs without depending on anyone. He used to treat all the poison cases, emergencies, because you know very well nobody else can treat an emergency better than an anesthesiologist. So even a physician, even whoever it may be, nobody can treat an emergency case better than an anesthesiologist. So you have to have a different thinking. And one of my friend thought it differently, and he established an ICU care center where he used to receive all the poison cases, all emergencies he will admit, and he used to call the specialists like cardiologist and nephrologist and other people. Like that, if you want, you can always have an option in future. So any super specialization available is a ninth question. Yes, it is available. Super specialization is now coming up for anesthesiologist, critical care, cardiac anesthesia, neuro anesthesia, special anesthesia fellowships are available. Especially if a cardiac anesthetist, if you become a cardiac anesthetist, for one case you can earn up to 20,000, 30,000 also. So it is very comfortable, less stress compared to freelancing of all the cases. So there are multiple options available. And 10th question, what is the basic indication to take this course? So because you should, I'm telling you, most of you, why you take anesthesia? No, I'm telling you, because you have got rank above 12,000. So up to 12,000 rank, you will be getting most of the clinical seats like MS General Surgery, MS OG, something, at least MS ENT, MS Opthal, something you get. The last filling clinical seat is MD Anesthesia. So you feel instead of going for a non-clinical subject, let us take an anesthesia. It is a clinical subject. So please don't take anesthesia thinking in such a way. Anesthesia needs so much of preparation, so much of commitment, so much of dedication, and after all this, you are going to be an unsung hero with a huge amount of money on your head. Therefore, if you are going to take this course, you should take with a basic interest. You should be ready for facing any of the things whichever I told you so far. So otherwise, anesthesia is an excellent course, and the anesthesiologists are excellent people who are saving millions of patients without being known to the even medical community.